and the memories.
Good evening and welcome to Transition Talks Tuesdays. My name is Tim Markle. I'm director of the Wisconsin Youth Health Transition Initiative. With me is my adult son, Hunter,
Hello.
and he'll do a little short introduction later, but wanted to remind you that we are very thankful that this fall 2024 series is also being brought to you in partnership with the three Autism Society affiliates of Wisconsin, Autism Society of Greater Wisconsin, South Central Wisconsin, and Southeastern Wisconsin, as well as the Children's Resource Center South. So glad you're here. If you're just joining us, if you could put your name and your email into the chat feature, that way I'll be able to get you on the attendance list because I will not be able to take attendance tonight because we're going to talk about healthcare transition together.
Yes, yes,
Yeah,
we are.
yeah. So I'm just not going to sit there in the background this time.
No,
I'm going to be talking.
right.
So hey, let's give this a shot here. Let's see how we could
Oh,
do
this is
this.
always the fun part is trying to get Zoom to accept the PowerPoint without
Exactly.
breaking anything.
All right, so let's see if Zoom's going to be nice to us tonight, Hunter.
He is hoping. He is hoping.
All right.
And I think
Well,
we are
okay.
good.
So I am going to go ahead and assume that we are good. I'm also going to see if I can extend to a gallery type view there. There we go.
Oh, and you
So we could
maximize
see
chat
more people.
participantness there.
There we go. All right. That way I'll be
Yay!
able to see if y'all raise your hand or something like that, or if you want to do so. So tonight we are going to talk about building a bridge. So we deliberately used a bridge because we know that it can seem we would love it if life was like the seamless transition to the next step. But there's sometimes where it seems like we need to almost get over this little gulf and we need to prepare
Little,
and this little gulf between adolescence and adulthood.
little.
Yeah, it's tiny. Just this little, it's I mean what? It's 17, 364, and then the next day you're 18. What's the big deal?
The big deal is they become an adult within a single hour,
Oh, that's a good point.
within
And
a
there's
day, maybe even up to a minute.
and there's a lot of changes when that happens.
Oh, there are plenty of changes. So calling it a little gap is like calling what's going on across the globe a
Oh,
little
careful.
file.
Okay. Okay, there you go. Good. You didn't go quite
No,
quite
no,
as dark as I thought you might.
dear God, the world's dark enough as it is.
It's a really good point. All right. So, Hunter, go ahead and introduce yourself.
Yes. My name is Hunter Markle. I am a young adult with autism. I am on the spectrum and everything because of that. I also have high anxiety that I'm working on, along with working on my depression. As he stated before, I am this crazy man's son, and thank you all for joining us on this Tuesday where the crazy train is currently on fire.
You haven't even watched any of the coverage yet. You have no idea.
No,
Things could be going nice and smooth for all you know.
considering who the two people that are
Okay.
running.
Okay. We're gonna continue on. So I am this guy's dad, and sometimes we help keep each other on the track. I also work for
Attempt
the
to.
Children's Right Attempt to Children's Resource Center South, as well as one of our training programs. I did want to remind everybody that Wisconsin is now home to the Wisconsin Wayfinder, a statewide approach that connects families and professionals to free information referral services that support children and youth 0 to 21 who have delays, disabilities, special health care needs, and other conditions, including mental health conditions. Some examples of resources can include referrals to providers and therapists, parent-to-parent supports, working with schools, what local events are coming up, conferences, how to access public benefits, and so much more. The backbone of the Wisconsin Wayfinder system is our 5 children's resource centers throughout Wisconsin. Wherever you are in Wisconsin, there is a children's resource center that is there to help connect you to resources, connect you to support. They love to have conversations. They love to listen to what you already have going on and then talk about what more may be out there for you.
I still feel like we should just isolate Milwaukee and just call it its own regional
Oh, I
center.
know. It's so Milwaukee is so big, but they have
Yeah,
they have other counties out there too that they do a good job of reaching. So tonight
true.
we're going to talk about moving from child to adult healthcare. We have two learning objectives that we're going to focus on. One is define what youth healthcare transition is, what it is, and why it's important. And then we're going to give you some tools and some resources for you to be able to help yourself and help your families.
Don't forget to add Nancy onto your fun
Oh,
little
thank you.
Excel
I
sheets
will. I
later.
see that she is there. So, to start with, let's go ahead and make a definition. So, healthcare transition, you'll hear it, you'll see it as HCT, is the process of getting ready for healthcare as an adult. Now, it's a lot more than that.
Oh,
But if you
100%.
if you boil it down, what we're talking about is there's an adolescent who's getting ready to move into adulthood, and their health care, the way they get health care, who gives them, who works with them with health care, there's going to be a lot of changes in the way that the system works. And
Even the
so
hospital might change.
absolutely. And so we want to get you ready for that. So the way we're going to do this is we're going to talk about what I like to call is the three different parts of transition. Okay, you ready? You remember
Right.
this part, right?
Yes.
Okay, so first is we have from birth through around, oh, let's say 18 for the sake of today. So from birth to 18, this is the time you have to do this preparation. During this time, we're learning skills. We're practicing how to do new things, like how to talk to people. We're practicing who we are. We're learning about our disability. We have all this time up to 18, and that's the time that we're spent preparing for the transition. Okay. Then there's going to be a time at 18, not yet.
Mm.
Oh, where there's this transfer of
Okay.
care. Okay. So at some
Then it's
point,
graduation.
they're going to leave the adolescent, the youth and child health system, and they're going to move into adult system, and they're going to transfer their care. Now, this sometimes will happen at 18. It might happen at 19. It may happen at 21. It may happen at a
If it
different
happens
time.
past 21, please,
Well, it could.
it
It
could,
could.
but please seek extra help.
Yeah, we prefer that it wouldn't. But sometimes specialists are able to keep seeing people into younger adulthood. There's also some family practice doctors that can keep seeing people. Okay. But even with family practice doctors, there's going to be a transfer from the child system to the adult system in the way that um, uh, appointments are run and the way appointments are made. So there's going to be this actual transfer of care. And sometimes that includes putting together, we'll talk about this a little later, a health summary so that the new system, the other side of the system, knows what happened during all this time. Now, we have the preparing for transition, the transfer of care,
And the
then,
successful integration into adult healthcare system
and how long does that go?
until you leave.
Yes, it's the rest of your life. And so what we have is we have this short time to prepare this transfer of care, and then we have the rest of that person's life. They're going to be integrated into that adult healthcare system. What we want is we want them to be utilizing and understanding the adult care system closer to this transfer of care than sometime later in life. And so this whole time is spent getting them ready for this. Okay, so keep that in mind. What we want to talk about now are what we've identified as some tools that you can use during this time to prepare for adult transition. So we're going to try to talk about 8 tools tonight. Sometimes we don't make it through them all.
No,
No, sometimes we get distracted.
mostly because of me.
Well, yeah, I get distracted sometimes too.
Yeah. By the way,
Sometimes
before anyone asks, neither of us have ADHD or any form of attentive disorder.
true.
We're just who we
Distractible.
are. Yeah.
Yeah. Yeah. So we're going to talk about 8 different tools. We're going to break it down into 2 sets of 4. Now, in the in case you got late, I did want to point out that this presentation does have a workbook that goes alongside of it, kind of, that you can open up online if you prefer to follow that workbook online. So there's some link for the workbook is in the chat, and you can find all of that at the Health Transition website. So let me throw that in here as well. Um, And all right. So
Okay.
sometimes I'll refer to the workbook. I don't refer to the workbook a lot because I jump around a little bit more than the workbook does. If you guys have known me now for a few weeks, you know I'm not always the most linear person in the world. This is more my life.
What's
So
being linear?
right, that's more your life too. All right, let's get into this. Let's go. So we're going to talk about the first four of these tools. We're going to talk about adult providers, about me, decision making, and medical insurance. We are so
Hey, I need
lucky.
to work on one of
You
those.
do, and we'll talk about that. So let's go ahead and let's dig in and let's start talking about me. Now, a
I have
lot
about five of those.
of composition books.
Yes.
Awesome. Um,
I hope one of them is empty.
I hope so too. Um, So when we talk about me, some people think that this is just like a form, and there are about me forms out there. We have some linked from our website and from our workbook that you can go in, and it just highlights different parts of the person. But what I want to help you understand is that this whole sense of about me is the idea that for most of your growing up,
Mm-hmm.
I'm the one or your mom was who talked about who you were,
Yep.
what your personality was like,
Yep.
what you liked, what you didn't like,
Yep.
how you like to be touched or not touched,
Yep.
about what could help you get through rough spots.
Yep.
That was that was us talking about you.
Yep.
At some point, it became really important that you were able to tell others about you, that
Yep.
me and mom were no longer the ones, that you began to understand what your likes and dislikes were. Did you like to, do you like when people come up and make small talk before and talk about hobbies before they
Eh.
get to what's supposed to be happening in the meeting?
Eh.
Do you like people that go into a doctor's office and it goes right to the point, or do you want to spend a little bit of time getting to know him
No bit of
or
time
her?
getting to know them.
Okay, so a little time getting to know them. Do you have anything that helps you if they say, "Oh, you need a shot"?
Yeah, sure. What shot?
Okay, so you're not bothered with shots, but
Nope.
some people they want to be distracted. Maybe they want to hold on to an animal or they want to hold somebody's hand.
Oh, when I was a child, I loved holding on to the oh, what was it? Oh, I have it downstairs. I can't remember what I called it as a child.
I have absolutely no idea what you're
Oh,
talking
it's that
about.
weird cow blanket combination thing.
Oh, yeah,
Yeah,
that's
what
right.
what did I nickname that?
I do not remember. So you could think about that.
It's going to haunt me until mom gets
I
home.
love that. You're haunted. We're still in Halloween time.
Ah,
But we talk about what health conditions they have so that
yep.
Hunter can understand how to explain his health conditions to other people. Along with, any other details that are like specific to him so that he can begin to tell other people about it, including beginning to tell his doctor's team, his medical team is sometimes all the medical team has is a chart, is that medical record that's pulled up on the screen, and sometimes it feels like our kiddos, our adults become more their diagnosis than their person. And so we want to encourage our young adults
Mm-hmm.
to to talk to the doctor as young as they can. So this is part of the practice skills is instead of, again, growing up, it'd be in the doctor's office and the doctor would say, so, when you were younger, Hunter, how are you? Do you
Good.
remember what you would do? No, you wouldn't answer good.
No, I would just turn to look at you guys.
Yep, exactly. So that's what most kids do. If the doctor would talk to them, they turn to their parent and they say, well, how am I? And I'd be like, why don't you know how you are? Well, we never taught him how to explain that. So it's part of teaching that. So we want to teach the doctor to talk to the patient and we want to teach the patient to talk to the doctor. We can help facilitate that during this practice time before they are responsible for their own adult care. So we want our children to get used to describing maybe how it hurts, start to identify what does it mean when my body is hurting, identify where the different body hurts, and be able to describe their disability to
Sure.
the doctor.
By the way, did you notice that on your slide there's the word sharp? I
Yeah,
only just noticed that. Why is that on the picture?
I will figure that out later. Thank you.
You're
I
welcome.
never noticed that.
I win a cookie.
Yes, you may have a cookie afterwards.
Yay!
So this is all in the area of building independence. And it also goes into helping the person with the disability, young adult with the disability, learn how to then disclose or talk to others about their health condition.
Yeah, don't disclose online for the love of everything, especially on social media platforms. You'll either get a bunch of people who are going to rip into you because of the disability, people that accept you, or people that are just like, okay, I'm just going to share this for
Mhm.
likes and say it's my story.
So how do you know when someone's safe to talk to about your autism?
Most of the time it's at conferences.
Okay, and then how do you decide who who or when you're going to talk to people about your disability and about who you are?
Mostly after like one or two, maybe three meetings in total.
Okay, so you have a short conversation with them, you get to know them a little bit,
Yeah.
and then you make a decision whether you're going to talk to them about your autism or not.
Yep.
That makes sense to me.
Yep.
And you have given me permission to talk about you.
Oh, 100%
Okay,
because ironically enough, I trust you more talking about it because one, it's your job. Two, you're becoming a coach
true.
and everything in a side hobby. And third, you're my dad. If I couldn't trust you, then why am I still living under your roof?
Thank you. And I love the fact that you're living under my roof
Literally, I'm literally living right underneath the floorboards.
in the basement, not under the
Yep.
floorboards.
No, I'm not that
You're
much of
not,
a
no, we don't
gremlin.
just put it, no, no,
No, I'm
it's an
not that
actual, yeah, you
skinny.
actually have a basement. Um, so this is one of the things that I think is most important because we can go through and our kids can go through their lives without understanding that they have a voice, they have a right to talk about themselves, and that's part of being an adult
Yep.
is learning how to talk about who you are and what's going on. And like I said before, there are some forms out there that are helpful when you're introducing your child to a new doctor, maybe to a new school, to a new place of employment. Um, so those are out there, and they can be some fill in the blank stuff. And I'll try to send at least a an example when I send the other notes for this meeting. All right,
Please tell
let's
me you're going to use John Doe or John Smith in the name.
Will Wilson. I'm going to use Will Wilson.
Oh, you're on to W's now?
I am. I am. I
Nice.
know. I
How
know.
are you going to do Z?
I don't know. I don't know. Zaire.
Hmm.
Um, so let's talk pediatrician. So you had a
Yes.
pediatrician growing up.
Yes, I did. A
And
lot of kids did.
yes, a lot of, but not all do. But we're going to
No.
talk right now for those kiddos that have pediatrician or those families who kiddos have pediatricians right now. Do you want to tell the story about your pediatrician?
You can start it off.
All right. So Hunter got to be in his teenage years, and I started to realize that I was doing most of his healthcare for him and that he wasn't very involved in the doctor's office. And I started to learn this stuff about healthcare transition. And so I talked to Hunter's doctor. And I'm like, you know what? I want you to be able to spend a little bit of time alone with Hunter because I want Hunter to understand that his health is about him and that he is the one that can talk to the doctor and has a right to have that alone time with the doctor and confidentiality with that doctor. Um, so I explained this to the doctor, and he didn't understand. He said, I don't know why you don't want to be in the room. I'm like, well, I want Hunter to understand this is you are his doctor. You're not my
It's
doctor.
my
And
life.
so I asked Hunter to do the same thing. I said, Hunter, I want you to
Yeah,
spend a
I
little
did
bit of
not
time.
understand that. I did not. You talked to a teenage child that barely even had any friends during elementary school about why you want him to be one-on-one with the doctor. He's just going to be very confused and wonder why are you even asking this?
So I decided I didn't handle that exactly perfectly. But what I did know,
Well, you're human. We handle nothing perfectly.
that's true. But I did know that I wanted Hunter to experience having a doctor who would listen to him and could help him in his growing up. And so I introduced him to my primary care physician. And they hit it off. And that's how Hunter got his new who's still
Yep.
his primary care doctor, even though he hadn't turned 18 yet. So, what do you like about your primary care team, your medical team, as an adult as a young adult with disability?
Uh-huh.
What do they do that helps you?
They dumb down every term of the medical Bible, that is the dictionary of the medical world.
So they make it simple for you to understand.
Yes.
Okay. What else do they do?
They laugh at my jokes.
That's important.
They are very nice and down to earth,
Okay.
and their signature is actually legible. It's not squiggly lines that look like it's from a cartoon.
That's true. His signature is very legible. You
Unlike
are absolutely
yours.
correct. I know, but yeah, I hadn't really thought about that before. But yeah, we have a doctor who has a very legible signature.
Yeah, it's
The other
amazing.
thing, the other thing that I noticed when I have been there, which I'm not with him a lot now,
No.
at the doctor's office, but the other thing that I noticed is that they seem to slow down a little bit
Yep.
and they take their time with
Yep.
you and uh, like make sure that you understand what they're saying
Yep.
and make sure that you understand your instructions and not just let you nod your head, but really make sure you understand.
Yep.
So those are sort of things that I think we're looking for in adult providers. Now, you may not be able to have the same situation that we had,
No.
but the other ways that families have found new adult providers is usually the first person you talk to is whoever your current adult provider is. Now, this could be for primary care. And so you could be seeing a family practitioner who says, I'll continue to see you after 18. Great. If it's a pediatrician, then you're going to want to say, okay, who do you know in the system? Because probably still going to have the same insurance. Who do you know that would be a good primary care provider that can help me to coordinate like Hunter's care and the specialist that Hunter may need to see? Which brings us to the fact that it's not just your primary care doctor that changes, is a lot of our kiddos and Hunter's friends have specialists that they have to go see,
Hmm.
whether it's an endocrinologist for diabetes or whether it's
Wait, that's what they're actually called?
yepper,
Oh, that's
maybe I
weird.
know, occupational therapist maybe, or some sort of
Met my old
specialty.
one.
Mm, cool.
Yeah, she was at the last conference.
That's cool.
Yeah.
I didn't know that.
No,
Um,
yep.
And so you want to talk to that current specialist to see how long they're going to be able to still see your child before your child becomes an adult. And then who would they recommend in the adult world? Now, sometimes that just doesn't happen or it's not a good mix. So the
Or it
other
just
thing,
takes time.
it does take time. The other thing that families have done is they've found those family organizations that like if I was looking for another family that could help me with Hunter, then I would
Hey,
probably go to the Autism Society. And I would say, okay, other parents in the Autism Society, who do your kids see as a primary care physician that you enjoy? What specialist seems to work well with your child, with your young adult? I would try to pick the brains of other families.
not in the literal sense.
Right, we're not zombies.
No, I was
Um,
more thinking Hannibal Lecter.
oh no, we're definitely not.
No, this is not the time for Silence of the
No,
Lambs.
no. Um, so you
I
could
really
utilize
need to see those movies.
other people's brains. You could call the resource centers. You could call the medical system to find out who's available, who, if any, specialists are. One of the problems is there's sometimes not a lot of people who also understand disability in the adult world because we have children with disabilities living up to be adults with disabilities, and then they're growing to be older people with disabilities. And this is a whole new field that really hasn't been dealt with before. So what I like to tell parents is that you're absolutely right. You may be out there somewhere where you don't have many options for primary care. And you may not be able to find that unicorn. Like I feel we found a unicorn, someone who really works well with Hunter. His team works well with Hunter. They're amazing. You may not be able to find a unicorn, but
I would
can
take a rhino sometimes as well.
a rhino would be good.
Yep.
But you could also look for an interested horse.
Mm.
So it may not be a unicorn, But if you can find a doctor who wants to learn along with you and is open to you talking about your child and learning more about your young adult,
Yeah, you don't want a donkey.
yeah, yeah, stay away from the donkeys. But
Yeah.
you may not be able to find a unicorn, but maybe you can find an entrusted horse. The other area I want to remind people about is the area of dental. Now, we already know that there is a problem with getting pediatric dental care if you have disabilities. Well, the other thing is just like the adult system, the dental care system can be very different as an adult. Now, just think about the fact that for most children, when they go into the doctors, they may be able to see multiple specialists at once to get lab work done right at that same day. And sometimes the rooms have balloons and they're colorful. And that's not always the case with the adult system, is sometimes you have to make sure you have your blood work done beforehand. They are expecting you to come in with the information that they need. And it's a different experience. And the same with dental is there's more of a expectation of self-care when you deal with adults. If we have spent a lot of time with our kids not teaching them self-care, they may be a little lost in the adult system. And so that's where we start to build these skills. Does that make sense?
Yes. Sorry, I was singing Linkin Park in my head.
Oh, which song?
Lost.
Nice. Nice. All right. Let's talk about decision making. I'm not going to go too deep into decision making because we have a recording on supported decision making and guardianship that you can go back and
Uh,
watch. But I do want to remind people that decision making is one of those things that we get better at it the more we practice it. So,
yep.
Hunter, this is why growing up, we would ask you things like, what shirt do you want to wear? So that you
Whatever shirt
could,
that's clean.
right? So, yeah, you were really big, aren't you? You didn't really care too much.
No, I still
Um,
don't.
but about food, about what your preferences are, so that you can learn to
That.
make decisions. Like when you
Yes.
bought your car,
Yes.
you made that decision
Right. And
because we had helped you make decisions up until that point.
I'm still shocked at the deal I got for my car.
You did really good.
We did really good.
We did.
Also, the dealer is very nice.
But there's this whole sense of that what happens sometimes is that we 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 almost feel we have to make all sorts of decisions. In some ways we do when they're growing up. It's we do need to protect them. We do need to be that papa bear. But we also need to help them learn how to make decisions, help them figure out what are the consequences when you don't make a good decision. What are the good things that happen when you do make a good decision, so that when they turn 18 and all of a sudden they are legally an adult, if nothing changes, they are legally an adult and they are then responsible for their decisions. If they've never made a meaningful decision before in their life, we can't really expect them to be ready to make meaningful decisions just because they're a day older.
There's a really bad joke I want to make right now, but I'm going to avoid it.
Thank you.
You're welcome.
So do you feel like you are in charge of making decisions in your life?
90% of the time, yes.
And so how do you feel about having that decision making ability 90% of the time? How does that make you feel?
Happy.
Okay.
Also, I really hope the recording did not pick up the echo.
It doesn't matter. I don't
Okay.
think it would. So we already talked about the fact that we have a whole recording on power of attorney, the medical power of attorney, guardianship, support decision making. I do though want to remind you that our partners at Family Voices and Wisconsin Board for People with Developmental Disabilities,
That was the conference we were at.
Self-Determination Conference, they have some really excellent resources
Amazing
on
resources.
supported decision making. So they'll be in the resource sheet that we'll send out. All
That
right, let's
you'll send
talk.
out.
Yes, that I'll send out. Let's talk a little bit about health insurance.
Yay.
All right, here we go. A lot of our kiddos have Medicaid. That is the combination of the federal government and state government providing health insurance, health benefits coverage for certain groups of people that they determine. So you may have a child, if your now child or young adult has a forward health card, then they have Medicaid. In most cases, but not all, that Medicaid's going to stay active until age 19. Some of it does depend on whether they have Katie Beckett as their form of Medicaid or just straight Medicaid through the state. Um,
We really need to nail that down.
well, it's hard to nail down. But the thing is that if you is that before your child turns 18, depending on what kind of Medicaid, you need to take steps. It's not going to roll over automatically into
Yeah, it's
adult
not like a
Medicaid.
dog.
Right. And it's not Social Security also does not roll over automatically. Is you have to make sure you take steps to re-enroll as an adult in Medicaid, to re-enroll in Social Security. The same thing,
We
we'll
really
talk,
love our paperwork here in
we
this
do,
country.
we'll talk long-term supports in a minute. But the thing is that thanks to the Affordable Care Act, is that
Woohoo!
children can stay on their parents' insurance until they're 26 years old. Now, adult children are allowed to stay on their adult system, their adult insurance, for as long as the insurance company says. But it's up to the insurance company. So if you have an adult disabled child and you want them to continue to be on your insurance, your private pay insurance, maybe it's through work or whatever, you need to take those steps before they turn 26 to work with the insurance company to say, I have an adult disabled child. What do I need to do to keep him or her on my insurance indefinitely past age 26? I thought it was a one and done. So we did this with Hunter
Yep,
when he was 25 and a half or so. And
just
I
about, yeah.
contacted our insurance company and we turned out the paperwork. We got the paperwork into the doctor. The doctor got it back. We filled out our end of the paperwork and our insurance company came back and said, well, we'll cover him for one more year. I'm not really sure what they expected was going to happen in that year. Um,
Time travel.
Not sure. So now Hunter is on the exploration for finding how to get his own insurance. What,
Hooray!
whether that's going to be through work, whether that's going to be through Medicaid, whether that's going to be through the health insurance marketplace, or he's going to find a private insurance plan. But he's working on it, which I'm really proud of him. We just had discussion about that again today. Um,
Yep.
so it's good to be, he's not going to be 27 for another month and a half. So we're all over this.
Yes. Well, we're like
Sort of,
bees on a flower.
closely anyway. Now, some of you may also have kiddos that are covered by the Children's Long-Term Support, CLTS. So if they have CLTS, you would have a case manager, someone who is helping you, your caseworker, that will help you find your way to the Aging and Disability Resource Center to then do another functional screen to see if they are eligible for the adult system. Again, doesn't happen automatically. But if you have children's long-term support, your caseworker should be helping you to make that step to the Aging and Disability Resource Center.
Dear God, the
So
amount of paperwork.
if you're, yeah, it's enormous. The amount of steps to get between the children's system and the adult system, there's a lot. There's a lot of steps, which is why we're talking about it now.
Yeah.
But if your child is 17 and a half, is on children's long-term support, and your caseworker has not talked to you yet about the Aging Disability Resource Center, you need to have that discussion with them
Yeah,
so
get it
that
done.
you could get prepared to be hopefully covered by the adult long-term support system, if that's appropriate. When we don't know at the Children's Resource Centers, when we're not really sure what's going on, we do have this awesome group of people called ABC for Health. They do short videos. They help us with really tough cases on benefits. They help us help families when they get denied to try to understand why that denial happened. So I would encourage you to take a gander. Next time you're up late, can't get to sleep, go to safetyweb.org and you'll probably find a video that has to do with whatever your questions may be around health benefits. Okay, so there we are. That's four.
Yeah.
4 out of 8.
Yes.
I haven't had you talk much. Why am I talking so much this time?
I don't know.
Okay, you talk. All right, we're going to talk about
Alrighty.
appointments, emergency contacts, health summary, and medications. All right, go ahead. Let's talk emergency contacts. What would you say? Why do emergency contacts matter?
Emergency contacts matter in the case of physical accidents, mental health, and just overall human problems and everything. And the emergency contacts can be everything from the young adult's mother to the young adult's guardian, grandparents, their best friend who they trust, to a trusted teacher, the school district as a whole. 911 is automatically programmed into
Hmm.
90% of today's cell phones. If you have a cell phone from the 1980s, please sell that thing.
It could be worth money now.
It could definitely be
Yeah.
worth
You
equal
never
to
know.
an
You never
iPhone
know.
13 by
You can
now.
also have your insurance to know which hospital or insurance you're
Yep.
covered. And now back in the day, Hunter,
Back in your day,
back in my day, if I wanted to carry around emergency contacts in case something should happen to me,
yeah,
like
you
when
have to
I'm
carry in a Rolodex.
I did not carry a Rolodex, but I would have to write it out.
I love the
Or
fact that I know what a Rolodex
I
is
so do
at
I.
26.
That's really kind of amazing.
I blame him.
But I would have to write it on a piece of paper, put it in my wallet, and carry it with me.
Yeah, medical insurance cards.
Yeah, and medical insurance
I
card.
think
So
I have like three of
what
those
do you
shoved in my
do?
wallet.
What do kids, young adults do these days for their emergency contacts?
Cell phone.
Put them into their cell phone. And so this is an area where the workbook has steps
I think you accidentally turned it
about, I
on.
did, about how to put emergency contacts into your cell phone, whether it's an Apple or an Android, about
Or
how
those weird Google
we're
ones.
not even going to talk about those Google phones. But it's how to get your emergency contacts in there. Because of the fact that we have realized that a lot of our young adults don't carry wallets. A lot of them may
Even
not
though they should
regularly
because
carry wallets.
ID.
Right. They may not regularly carry their ID, but they are almost all regularly carrying their phones, which can have their insurance card in it, can have their health insurance card in there, as well as emergency contacts. So those steps are out there.
Yep.
Let's talk a little bit about making appointments. Now,
Yes.
so back in the day,
Back in my day, when I was a teenager, I was not the one to make appointments. That was up to them, as in my parents, as I
Mhm.
was the type of kid that did not like talking over the phone.
So you may
Still
know
somewhat don't.
that a lot of young adults these days, they're not very comfortable talking on the phone. But again, back in your teenage days, that's the way we made appointments.
Yep.
Is we would call up, we would talk to the appointment desk, or we talk to the nurse, the
Receptionist.
receptionist, and
They have a
we would
proper
make
title
the
now.
appointment. So what we did was I really wanted Hunter to be able to make his own appointments. And so we went over what the receptionist was probably going to ask him.
Yep. Birthday,
Mhm.
name, place of residence, and there was one more. I can't remember the fourth one.
Insurance.
Thank you.
And
Copay.
oh yeah, and whether there was a copay for this visit. So teach them all these fun terms as well.
Yes,
Um,
money is everything,
and so in the world, unfortunately. So I
especially when it
would
comes to healthcare.
so we started with just him being in the same room as I would make an appointment and go over these things. And then I would
Yep.
ask him to answer some of the questions,
And then I would promptly leave the room.
like run out of the room.
No, shuffle or just
Hmm.
walk a little faster than
Hmm.
usual.
So I didn't make him talk on the phone more. So then as he got older, technology changed.
Yes.
So now, so we did try, even so we would help you make your appointment.
Yep.
Then when we showed up, we would ask you to go with us up to the desk
Yep.
and again have you check in
Yep.
so that you learned what they wanted,
Yep.
and then we would all wait together.
Yep.
Then technology changed. So how do you make your appointments now?
Through the gloriousness of my chart, thank you, Dean.
So great way to tell them who your insurance carrier is. Don't tell them your insurance number. Just saying, don't.
Wait, I
Don't.
have that?
Oh my gosh. So how do you make your appointments?
Again, through the use of my chart and everything through one of the drop-down menus called Set Up Appointment or Visits, as it's actually called. And then I would select a date, see if that date would work for them for me to come in. If not, they will send out another date, and I would see if that date works, time, and then again, online check-in because thank you, 2020, screw you, COVID. That is now out of my system.
Thank you.
You are
Do
welcome.
you feel better?
I feel way better that
Mm.
that's lifted on my shoulders because I really freaking.
So now you're able to make your appointments online,
Yep.
and we spent years teaching you how to drive. So you
Yep.
got your driver's license. So now you take yourself to the appointments
Yep.
and you check yourself in.
Yep. And I even set up my own appointment for a nutritionist that they did not know about.
Oh, I
They
forgot about
caught
that.
me just basically leaving the house some point in like late December, early January, somewhere in there. It was one of the winter months.
Yeah. And so he goes to leave. We're like, where are you going?
I'm going to go see a nutritionist.
My response was, you don't have a nutritionist.
I do. It was set up by my primary healthcare doctor because I wanted to gain weight healthily. As you can probably tell, it has yet to work.
But you
And this
still
made me
had the
lose a little
information.
weight.
Oh, thank you.
Yes.
Thanks for that.
Hey, I said a little this time.
That's true. That's true. You are being much kinder.
Yeah,
So all these
I'm
things
slowly
are,
killing you with kindness.
yes, you are, is we taught one skill at a time during this time so that during the adulthood, he now has more opportunities to be independent. We
Independence
know
is a good thing.
we know independence is a good thing, but it's also a myth. So
Yep,
we also encourage him that if he has any questions, ever wants any of us to go with him, we will
they
be
are
there.
always available.
Right. Because we're not stopping supporting him when he
No,
turns 18,
no,
but it just changes in who's
you're
making the
not a bird.
decisions. Right. We're not kicking you out of the
No,
nest.
no, we're not birds.
All right. So that's appointments. So engage as early as you can with the child will help prepare them for good utilization of the healthcare system as an adult. Feel free to go over that insurance card, talk about what a copay is. When it's appropriate, talk to them what the deductible is. We just went over a, oh my gosh, what's it called?
Not the thing for a bill, but
Right,
the
not
thing
the
that
thing for
comes
the an
before a bill.
explanation of benefits. So the fact that we will get an explanation of benefits. So I walk through why do we get this explanation of benefits, and
Yep,
then later he'll get a bill and have to pay it.
yep. The
Um,
gloriousness of healthcare
so
system.
right, all these little things that we can help depending on the capacity of our child
Hmm.
and what we want to do. We can teach them these things. All right, let's
Yep.
talk medications.
Yes, let's talk medications.
Mhm.
What the crap is
I
that
know.
language on the... No, go
That
back a
was that was
slide.
that was German. I don't have to go back a slide. I know what it was. That was German. So
Where did you even find a
I
German
know, I know,
one in
I don't
German?
know, but that's yeah.
What did you
It
Google?
was German days of the week. So
Okay.
anyway, so let's talk medic focus.
Yep,
Let's
focusing.
talk medications.
Well, for one, I've never been on them technically.
Well, you have, but
I
you're just
have, but
currently
it's
not.
not current.
But you do currently take supplements.
Yes, I do.
So how did you start to be able to take supplements regularly? Because we know taking things regularly is
Back aside is because I had something like that.
okay.
It
I'll go
wasn't in
back a slide.
German, but it was
So,
definitely one of those
so
things.
morgens, morning, mittags, noon, abends, evening, and then nachts, night.
Then what the crap is the last one?
Doll?
Yes.
That's the name of the company that made that.
Okay,
I don't have any
thank
idea. I
you.
made that up. But
Yeah,
you go
most
ahead. You
likely.
go ahead. So talk
But
about
no,
your
I basically had one of those, but it wasn't morning, noon, evening. It was Sunday, Monday, Tuesday, Wednesday. It was a week one and everything because I had to take them weekly and every
daily.
daily.
Yep.
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 But not like on, again, mornings, noons, or evenings,
Hmm.
as they were supplements, not true medications. The only true medication I was on was an antidepressant and
You've
everything.
been on other medications, like when you
Vitamin,
hurt your knee, when you had
that
your
was
eye
just pain
surgery, when you had
meds.
lungs issues.
That was
You've been
a
on,
Paler.
yeah. See, you've had stuff.
Yeah, I've had stuff, but
You've
the
had stuff.
most recent one was the antidepressants,
Mm-hmm.
and the only reason why I'm no longer on them was A, I ran out, B, I never refilled the bottle, and C, I did not like taking them.
Yep. And that was your choice. And we
Yep,
noticed that it wasn't really affecting either way. And so you made that choice and we monitor.
yep,
We just keep an eye on it.
yep. And the doctor then switched me over to taking supplements for sun
Mm-hmm.
and vitamin
But
D.
you
There
know,
we
from
go.
going to the
Ugh.
self-determination conference, you know that you have friends that are on multiple different kinds of medications.
Yep.
And one of the
And
things is
so
that,
many.
right, and it's so hard sometimes to tell them apart.
Yep.
And so one of the things that we encourage parents from that young age
Also,
or
double
the
check the
person,
side effects on every
everything.
medication that the young adult is taking, as sometimes said medication is giving the symptom of what that medication is trying to cure, or at
Yeah.
least
Yeah.
subdue.
So you gotta, right. So watch out for those side effects, know what
Yep.
the side effects are, and teach your kids what those side effects can be. Is teach them what the medicine is supposed to do
Hmm.
so they can know when it's not working
Yep.
and what the side effect is so they can know to talk to you and
Because some
hopefully
med,
to the doctor.
yep,
So no,
because
we're not going to get into the right,
antidepressants giving
right. No,
depression.
we're not gonna get into that
Oh, but
tonight.
I
We don't
like
have
that
time.
joke.
I know. So one of the other things that we learned about is that we try to help the kiddos figure out what the medicine is for. And so you know that
Yep.
medicines have horribly long names.
Yes, yes,
So
they do.
instead, what if we started by saying, okay, this is the one for your allergies, and maybe have a nose on it or something, or this is for your heart, picture of a heart, so that they start to understand that each medicine is supposed to do a specific thing. Um, some parents find it helpful to have their children identify the color and the shape, but sometimes because in this area of the cheaper medicines are not always the can sometimes be the generics, and those will sometimes change color and shape. So be careful about because some of our kids can get stuck on, well, it's no longer red. Yes, but it's still the same meds. But you want to do your best.
Why is it neon green?
So make sure you can help them understand what the medicine's for.
How would you even pronounce
Um,
any of those?
and then the other thing that we would recommend, so that's more like what you had.
Yep,
The other thing
though mine
is
was
to
purple.
feel free to go over the label on the prescription with
Yep.
your kids. Go over how many times you're supposed to take
It's
them.
still the same.
And then that then leads into the question about how do you refill your prescription? When I was growing up, I went away to college and I was really, really surprised when I ran out of medicine because I had never run out of medicine in my whole
Oh.
entire life. Whenever I would go to the medicine cabinet, I always had medicine. So I had never learned how to refill my own medicine. So teaching them, about how to fill it, talking to the pharmacist. Some of our kiddos do really well with foreshadowing, going in with them and talking before anything actually has to happen, and then going with them to 3 times until they're able to do it alone. That sort of scaffolding that support and then lowering that support. Um, Teach them that sometimes your pharmacies will text or you might have to call it in. Sometimes you can set it up automatic. There's a lot of different ways to fill prescriptions these days.
Yep.
But they're probably going to have to be taught how
No.
because it's not going to come naturally.
I'm just glad I can just buy my supplements at my place of work.
Yes, that's very fortunate. So the other thing, last thing that we wanted to talk about was this whole idea of a health summary. Some people also called it a shared plan of care. We're going to talk more about a health summary today. Is as you are transferring these systems, is there's all sorts of history, and you want to make sure you capture that important part of the history and the important part of what is currently happening. And you want that on a something that you can carry around. Yes, it's great that it's in the electronic medical records, but if you go on vacation somewhere, chances are they're not going to be able to access your medical records. If you have to go to the emergency room, you may not want them to take the time to access your medical records. And so having a written summary of these are the most important things that are going on, these are the main issues, these are the medications,
Yep.
this is what to do or not to do in case of emergency. Like I have some parents who they get really frustrated at the emergency room because they have a kiddo that you can't put an IV in the arm and they know that, and they try to tell the ED department, the ED that, and the ED doesn't listen to them. And so they're like, well, maybe if it's on a piece of paper with the rather help, do not even bother trying to put an IV in the arm. It's not going to work.
Yep.
And so these are the things that can be written out so that as you go to new places, new
Yeah.
or to places like our vacation, you have this available as well as for the new doctor or the new
Yep.
system you may have to change to.
And if you don't like no cards, some people do it on like dog tags or necklace and everything, kind of like with some Jehovah's Witnesses doing one where they can't accept blood
Oh yeah.
because of their beliefs and
Yeah.
everything.
So
So
you could
they
have
have a,
your medic alert bracelets, the
yep,
dog tags,
dog tags, necklace,
something. Hmm.
or tattoos.
It's true. I mean, I don't want my whole health tattooed on my back.
No, but just
That would
like
hurt.
a DNR, do not
Oh,
resuscitate
sure,
sort of
sure.
tattoo.
So that your wishes could be followed.
Right, exactly.
It's a really good point.
Yep.
Um,
But don't do it on little kids.
no.
Please do not tattoo your kids.
Now, the other thing that I want to remind people of is that as we talk transition, is there are actually professional organizations that have put
So many.
together some transition tools specifically for different diseases or for different conditions. And so feel free, we'll send these slides out after, I'll send these slides out afterwards.
Yep.
Feel free to look through and see if maybe one of yours is on there and you
What is
can
that
look
word
at
below sickle cell?
condition specific hemophilia.
Yeah, what is that?
It's a blood disorder
Oh,
where your platelets don't gel up with blood. Is your
ah,
blood doesn't clot.
okay. I've only heard that term twice,
Yep.
and it was usually in Criminal Minds after they do an autopsy.
Well, thank goodness you watch TV so you learn something.
Yes.
Now, you may be saying to yourself, this is a lot of information, and it is. We'll give you some resources, but I also want to let you know that just like schools give assessments to kids to figure out where they're at, what they know, and what do they need to know, there are also
Yes.
healthcare readiness assessments that are out there that go through, I know my allergies, I know my family medical history all those different, different areas. So they're available in English and Spanish. The one that we're showing is from our friends at Got Transition, which leads us into our resources, which one of our resources is an awesome national resource because Got Transition. They have videos, they have many video tests that young adults can take about are they ready for to take charge of their own health care. They have tools for families, they have tools for schools, they have tools for doctors. Their main thing is trying to help the medical system take charge of healthcare transition. And then in Wisconsin, we are fortunate to have Health Transition Wisconsin. That is the website for the Youth Health Transition Initiative,
Yep.
for which I work and for which Hunter volunteers.
Yep.
We are funded by the Title V Block Grant, not the most important thing in the world, but we do have
No,
to
but
acknowledge them. We're very thankful
yep.
for that.
It's free
Um,
government money.
and then before you leave, if you could do me a favor and take a screenshot, a little use the QR code, or I will also drop this into
The
the chat.
chat, if it worked, because
Right,
Zoom
once I
is.
find it again,
Yep.
and then that's how you can contact us. And again, we'll go ahead and get this sent out. So I want to
Yay.
stop the slideshow. I want to take the spotlight off of us and go ahead and open it up if anybody has any questions or comments. I know that was a lot of information, and I know we're not the most linear people in the world.
What's being
Um,
linear?
still doesn't, still not linear. Um,
No.
So please feel free, unmute if you have any questions, or comments, or go ahead and put them in the chat. I did just drop the survey, so that we could continue to figure out how to do this better. And now I'll officially stop that sharing.
Yeah, Excel sheet for Nancy. Don't
Yep,
forget
no,
about
I won't.
that.
I won't. Any questions, comments? We are a small but mighty group tonight, and I thank each and every one of you for being here.
Hey, I have a question.
Yep, please go ahead.
Rebecca, my screen says David. That's my husband. So our son turns 19 tomorrow. We're all three really grateful you're doing this tonight. We've been doing a lot of what you've recommended, but I guess is there any sort of like direction, further direction? You sort of touched upon this on how to get that adult provider. It feels like it's a real challenge in Madison to get a provider of
Yes.
any kind ever. So to make that transition for a kid who needs some extra time and attention, I'm a little at a loss about that.
Yeah, I wish I had a magic wand, but I
Everybody
don't.
does.
But in
So,
terms of process, I mean, in terms
right.
like, did you just obviously you were able to transition your son to your provider, so that was like just a natural fit. If you don't have that situation, like, do you have any words of wisdom? I mean, is it
Have
like
you talked to his current doctor?
we'll see her again next week. He's still with his pediatrician, but
Hmm.
last year she was pretty eager to transition him. I think her practice is, really busy. Everybody's really busy.
Yeah.
And so I was able to convince her that maybe we could put it off for another year, but I have a feeling when we go in next week, she's going to be like, "So, Jonah, you're 19."
So she should, I would hope that she would know some of the doctors on the adult side and help you figure out who might be a nurse practitioner or physician's assistant or a full MD that may, she knows, depending on how long she's been with your son, she understands him hopefully more than just any other doctor would. And so hopefully she might have insight into
Mhm.
who might be a good fit. The reason I say that is because if she does, and then you go to the clinic or the insurance company and they say, "Oh, I'm sorry, but the panel is full," then you could say, "Well, maybe I could have her write that recommendation or talk to that doctor to add one more patient to the panel."
Mhm.
Is that my doctor was able to open his panel up to take
Yeah,
Hunter as a patient because
they
his
can
panel
do
was
that.
closed.
Yeah.
Um, but I was able to have that conversation. So maybe the current doctor can have talk with another doctor. I know some families go online because they're limited with their insurance and they just start
Cold
with someone
calling.
who looks like or has the background that they think is going to make a fit and they start there.
Mm-hmm.
And sometimes it takes a while to find that fit if you have that option,
Mm-hmm.
for a fit, depending on whether you're in a big city or a more rural setting. Um, the other thing that we did talk about is connecting with any parent groups that may be out there whose child might have a similar condition as yours to find out who they go see.
Mm.
The other thing is you can always call the resource center and they may have some more ideas about the specific because they'll know the different areas a little
Mm-hmm.
bit better than I do. And they may be able to offer some help as well.
And which resource center? You most delightfully seem to point out many resource centers.
I do. I do. I love them all equally. They're just like my children. I do not love my daughter more than my son, no matter what she says. Don't listen. Don't listen to her. But if you call the Wisconsin Wayfinder,
Okay.
1-888 WISC-WAY,
Uh-huh.
they will connect you with your resource center.
Oh, perfect.
They
Okay.
will find that for you.
And
Um,
that will be in the slides that you share?
yes.
Wonderful.
Absolutely. And I hope to get them out tomorrow afternoon. It's
Yeah,
always
that's
my
great.
goal. I
Well,
haven't succeeded yet. It's
but
usually 3 days afterwards, but my goal is tomorrow.
hey, we're
Don't,
grateful for
don't people
anything
back.
you're willing to do. Thank you.
Thank you. Sorry, I don't have a better answer for
No,
that.
I mean, that's how these things go. But it's getting my cogs moving. I have some
Okay.
people I can ask. So that's good.
Yeah, and that's the way most families find, most families that I know is they're talking to each other.
Yeah, that's the best way nowadays.
Yeah.
Thank you.
Yeah,
Thank
you're
you.
welcome.
And that was Rebecca, right?
Yeah.
Okay.
Oops.
And Jonah. Hi, Jonah. Other questions or comments?
Nope, I think we're good. Thanks,
All right,
though.
fantastic. Well, thank you everybody for being here tonight. I know it's a weird night to join, but we really wanted to get this one in, and we're running out of Tuesdays. We do have some others coming up, so please feel free to join us for more Transition Talks Tuesdays. We do not have anything scheduled for next week, although we're going to be doing healthcare transition again through Family Voices of Wisconsin. So I'm not sure if we're both going to be doing it or not. But if you look at Family Voices of Wisconsin and their calendar, if you really want to hear this again, feel free. You can join us again next week. And then the week after that, we'll continue on with Transition Talks Tuesdays. Thank you all. Have a fantastic night.
Bye bye, everyone.